Welcome, folks. My name is Chris. I'm your life health exam coach. And if you haven't checked us out already, we are at lifehealthexamcoach.com. We have a whole set of training to help you to pass your life and health exam within 30 days, and we guarantee that. So please check us out, lifehealthexamcoach.com, and see how we can help you. Today, we're going to focus on the parts of Medicare. This is an important topic, and it does show up on the exam. So let's jump right in. And Medicare is health insurance that's administered by CMS, that is the Center for Medicare and Medicaid Services. That's a government organization. Medicare is government sponsored health care. It's a federal funded program, and it's funded by payroll taxes. We all pay into it all our lives when we're working. And when you turn 65, or if you have a disability, when you're under 65, you qualify for Medicare. So what we're going to talk about today are the four parts of Medicare. So it's not like health insurance when you're under 65. So it's important to understand how these four parts work, how they work together, and what your options are. All right, let's review. The four parts are Part A, Part B, Part C, and Part D. Pretty simple so far, right? Part A is your hospital stays. And most often, people who get Part A also get Part B, which is outpatient services. So if you have Part A and Part B, you're covered for both inpatient hospitalizations for whatever reason. And for Part B, you're covered for all the outpatient services that include going to the doctor, durable medical equipment, therapies, rehab, anything that happens outside of the hospital is going to be covered by Part B. Now, Part D is a separate plan, and it is your prescription coverage. So that's one of the differences in Medicare is that you have medical coverage on the one side, and then you have your prescription coverage separate from that. Now you'll see underneath there that it says that Part D is offered as a private insurance plan, and that's exactly how it works. These are plans that are set up by private insurance companies. They work in a contract with the federal government to offer the prescription drug coverage to the Medicare beneficiary. So, in certain circumstances, the beneficiary who qualifies for Part A in Medicare, they get Part B for their medical coverage. Then they have that option to get Part D, a prescription drug plan. So one of the reasons it is separate is that not every Medicare beneficiary decides to get Part D. So of course, encouraged to have some sort of prescription drug coverage, but it is optional. That's one of the big differences. Again, when you're under 65, these all tend to be in one plan. When you're in Medicare, your hospital, your outpatient, and your prescription are actually kind of separate from that standpoint. All right, let's move on now and talk about uh, that fourth part that's in the top right, which is called Part C of Medicare. This came a little bit later historically than Part A and Part B. Part C is called Medicare Advantage, and it's a different way of receiving your Medicare benefits. This too is a private insurance plan. Now, one of the differences with Part C, or things to keep in mind, it has to include by law, all the benefits of Part A and Part B. So again, Medicare is set up to provide both inpatient and outpatient coverage to its beneficiaries. So if somebody chooses a Medicare Advantage plan, a Part C, they're not going to be missing out on anything. They're going to have all of their Part A and Part B benefits covered inside of that Medicare Advantage plan. The difference is, again, like that Part D, it's a private insurance plan, is offered by private insurance companies who, again, make a contract with the federal government to deliver that insurance, that coverage to the beneficiary. So it's another option for people with Medicare. Just to confuse things a little bit further, hopefully after you we'll see this a couple of times, maybe review, it won't be confusing anymore. But Part C, Medicare Advantage plans, can also include Part D. So Part C and Part D can be encapsulated into one plan. And that makes the coverage seem and feel a lot more like what people experience when they're under 65, where you've got one card and it covers your medical benefits and your prescription benefits all in one card. But nevertheless, Part C and Part D are still different entities. Part C is going to cover the medical side of things, inpatient and outpatient, and the Part D plan is going to be the prescription coverage, and again, that can be included in the Medicare Advantage plan. So really, people have, two options. Honestly, they can stay with Part A and Part B for their medical coverage and get Part D separately, or you can go with Medicare Advantage. So just to recap, and to make sure that you remember the key points, the four parts of Medicare that you're going to need to know for your health part of the life and health insurance exam. Parts A and B are original Medicare and they're offered by the government. Part D is prescription drug coverage that's offered by private insurance companies. And then Part C is Medicare Advantage plans offered by private insurance companies, and those may include Part D along with them. So it's a little more complicated than a straight under 65 health insurance plan. But once you go over it a few times, you can learn these four important components of Medicare and then nail all the questions on your exam about this aspect of Medicare. Hey, thanks for joining today for this video. Remember, we've got other videos and training at lifehealthexamcoach.com, and we look forward to seeing you in the next one.